On the Health Beat tonight, we're going to talk about pedicure pitfalls. Our healthy reporter Anne-Marie Tierney now on fixing the fungus that attacks our feet. And this can be a huge problem for both men and women.
Well, absolutely, and it's unsightly, bottom line. It can make the nails on our toes not look so great. And until now, the treatment available came with risks to our liver and really not a guaranteed cure. But now there is a new and better option. It was a trip to the salon on vacation that led to a trip to the doctor for Betsy G-Tran when she got back to Indianapolis.
My girlfriends and I went for pedicures and mine became infected.
So infected with the toenail fungus that Betsy's nail fell off.
It's unsightly, it's uncomfortable.
Her podiatrist, Ron Banta, says salons can be a source for infection.
You need to make sure that, one, they're sterilizing their instruments. I don't really recommend a lot of foot baths because they're difficult to clean. You have patients before that maybe have had fungus, and so it's a good place to cross-contaminate.
For 2 years, Betsy tried Lamisil, a prescription medication which carries for some patients the risk of liver damage. It didn't offer Betsy a cure.
I think that the issue that we run into is that a lot of the medications slow the growth of fungus down, but it doesn't really kill the fungus.
But now a new option, the pinpoint foot laser.
It's brand new. It's FDA approved.
In clinical trials, 88% of patients grew a normal-looking nail after one treatment in 6 to 12 months.
It's the first treatment where we actually can say we have something that's definitive. And some people, the nails are just an inch, 2 inches thick. It literally destroys the nail from the inside out. Topical medications won't penetrate the plate. And that's the benefit of laser. We actually can go through the plate, through the tissues to be able to get to the fungus cells.
Betsy's procedure costs $975.
Totally painless. You feel a little warmth, heat sensation.
40 minutes later, she's out the door with a spray to decontaminate all of her shoes and with the hope that she'll be back in sandals come spring break.
I am very hopeful. Yeah, I'll let you know in 8 months.
And we will follow up to see how it goes. So far, Ron Banta is the only one to have this laser here in Indiana. He's treated 30 patients so far and says he'll track their results to see if he can match or beat the trial data. But the initial surge of patients, men, because they're not wearing polish on their toes, and it's much more difficult for a man to hide it when they have the toe fungus.
Well, Betsy will be walking pretty soon.
I hope so.
All right, Anne-Marie, thank you for the Health Beat tonight. John.
The storm clouds are gone, and now we're seeing just how soon.